In many Arkansas communities, patients are still having to travel just to get the care they need, especially for services like HIV care, hepatitis C treatment, and other specialized support. But what happens when those services become available closer to home? Dr. Leslie Ward explains why that matters. Let's get connected. Welcome to Connected, the podcast by Healthy Connections, where we bring you closer to the people, stories, and services shaping healthcare in our communities. I'm your host, Marisol. This episode is especially meaningful as we celebrate National Physicians Week, recognizing the dedication and impact of physicians across our communities. Your commitment does not go unnoticed, and we want to thank all of our Healthy Connections physicians for the care they provide every single day. Today, we're joined by Dr. Leslie Ward, a physician with Healthy Connections, previously named Best Medical Provider in Russellville, and now a credentialed HIV specialist through the American Academy of HIV Medicine. She primarily sees patients at our Hot Springs Central Clinic and also serves patients in Russellville. Dr. Ward, let's start with your story. When did you first know you wanted to become a physician?
I have wanted to be a physician since I was 11 years old, from my own medical experiences. A doctor, astronaut, went with doctor.
That's something we hear often from physicians, a calling that starts early. Walk us through your journey and what led you to where you are today.
So I grew up in Arkansas. I'm from Boonville, and I went to college at Arkansas Tech University in Russellville and went to UAMS in Little Rock. I did 2 years of peds residency and 2 years of family medicine. And my first job out of training was in Danville. Worked there for 5 years. I was with Conway Regional for 5 years and have been full-time with Healthy Connections since.
And now in your role, you're caring for a wide range of patients across different stages of life. What does that look like in your day-to-day practice?
We see everything. We see from kids to adults to, I don't want to say super old, but elderly. We take care of everything. We do just routine physicals, everywhere from blood pressure, diabetes. We do a few special things that a lot of primary care doctors do not do. So we have a lot to offer.
And that's really what primary care is all about: continuity, relationships, and being there for patients through everything. When it comes to your approach, what guides how you care for people?
I know I treat all patients like I would want to be treated as a patient. And try to show everybody respect. And care for them like they're my own family.
Welcome back. We're talking with Dr. Leslie Ward, a physician at Healthy Connections during National Physicians Week. We'll be right back after a quick break.
Sometimes the hardest part of change is believing change is possible. Across Arkansas, opioid addiction affects families every day. Hope is here. Treatment works. At Healthy Connections, compassionate care is available. Take the first step. Call 888-710-8220 or visit healthy-connections.org for a confidential appointment. Reclaim your tomorrow.
Welcome back to Connected. As we continue recognizing National Physicians Week, we're highlighting the impact physicians have in expanding access to care across our communities. We're continuing our conversation with Dr. Leslie Ward. Earlier, you talked about offering services that many patients would normally have to travel for. Tell me more about that and how you're able to provide that kind of care locally.
I do the medical-assisted treatment of opiate addiction with Suboxone is probably the most well-known drug for that. We have great resources for that because we do have access to behavioral health. That's really important to me. Being able to help people with history of addiction.
And that kind of care can make a real difference, especially in areas where patients may not have many options close to home. And that ability to provide specialized care locally is critical, not just for convenience, but for consistency and outcomes. And this is where your work really comes full circle, addressing gaps in care across communities.
I'm excited about having HIV, Hep C, MAT treatment in Russellville. There is little to no providers for those, and people usually will have to travel, and that's very difficult for some of the patients. And so it's going to be a great resource in that area.
And that's exactly why this matters, bringing care closer to patients and removing barriers that can delay treatment. You've also built strong relationships with patients in that area over time.
The last clinic I actually worked in Russellville, so I have many patients in that area, and I get Facebook messages multiple times a week. When are you coming? When are you coming? I'll also can provide telemedicine for my patients there if I'm not at that clinic, when they need or can be seen. We treat such a wide array of people and issues, and would be happy to see you in clinic. Just give us a call at Healthy Connections.
Dr. Ward, thank you for taking the time to be with us and for the care you provide to patients across our communities. And again, during National Physicians Week, we want to recognize and thank all of our Healthy Connections physicians. Your work strengthens our communities, improves lives, and ensures patients have access to the care they need close to home. Whether you're looking for a primary care provider or need access to more specialized services, Dr. Leslie Ward and the team at Healthy Connections are here to help. To schedule an appointment, call 888-710-8220 or visit healthy-connections.org. She primarily sees patients at our Hot Springs Central Clinic and also serves patients in Russellville. You can watch and listen to Connected every Wednesday on YouTube, Spotify, and online. Until next week, stay healthy and stay connected.